I'm Jackie Fisher from Muskegon Rotary Club. Good to see you all this afternoon. Introducing today two young women who work for Healthwest. Many of you may know that organization as Community Mental Health, but it's been Healthwest for quite some time. Cece Riley, on the right of our screen today, is the Communication and Training Supervisor at Healthwest. She has a bachelor's degree in communication from Grand Valley State University, and she minored in hospitality and tourism management there. She's been working in community relations department at Healthwest for 2.5 years. Prior to that, she was the communications director as the Muskegon Lakeshore Chamber of Commerce for nearly 6 years. Cece grew up in North Muskegon, currently resides in Fruitport Township with her husband, her 2 daughters, and her puppy. And she serves on many local boards and committees, currently serving as the director of the nonprofit relations on the Parties in the Park board of directors. In her free time, she enjoys attending local festivals. Not this year, they're all canceled. And kayaking, camping, traveling, snowboarding, playing board games, and spending time with friends and family. Lauren Meldrum is passionate about the intersection of health and social justice. Born and raised in Muskegon, after high school, she earned her Bachelor of Arts in Women's Studies and African American Studies and a Master's in Public Health from the University of Michigan. She then went to Chicago Public Schools and taught through the Teach for America program for 2 years, and then returned back to West Michigan. She served for 2 years as the Training and Social Marketing Coordinator at Artwork 180 in Grand Rapids, and then accepted a position at Healthwest, where she's been now for 8 years. Lauren serves as the Director of Community Relations and Project Director of the My Alliance System of Care cross-system initiative, working to support effective collaboration and trauma-informed, equity-focused system change within the community. We're going to learn more about that today. In her spare time, Lauren loves spending time with family and friends, live music and dancing, and all things glitter. Love that. So, Healthwest is a huge organization, and you have a wide array of services. Before we jump into that, could you tell us a little bit about what's going on in the area of COVID and what's going on in the community in your agency?
Sure. Just to give a little background for those who don't know, Healthwest is the community mental health service provider for Muskegon County. And so we serve individuals across the community with developmental disabilities, substance use concerns, and behavioral health challenges. And during COVID, we have been fully operational. However, it looks quite different than it used to. We have about 350 staff. We have 7 locations across the community. And during COVID, we kind of went down to one main campus, which is our mental health center campus located on Apple Avenue. It's the big, long street block building that many of you have probably seen. And so we've been providing the bulk of our services out of that building, although we are slowly starting to open some of our other locations as well. We've really moved into a new world of telehealth services. And so the bulk of the services that we are currently providing are still being done over the phone and using like Zoom video telehealth in order to meet people's needs. However, we're slowly starting to open up a few of our community-based services as well. And we kind of have a 4-step plan for how we're going to kind of reopen or maybe close back a little bit services depending on what happens with available personal protective equipment, testing, etc.
Thank you. You want to add anything to that, Lauren?
Okay. No, I think Cece covered it well.
Right, good, thank you. So tell us a little bit about Healthwest and the clients that you serve and what type of support you provide to them.
So we have a few different services that are available to people that we serve and who are actually enrolled in Healthwest services, and then also to the community at large. And I'm sure members of the Rotary Club would probably be most interested in those services that are accessible community-wide. For those who are actually enrolling in Healthwest services, we traditionally serve individuals with Medicaid. However, as the health system and the mental health system kind of evolves, we are starting to take more and more private insurance as well. And we offer a full variety of services to individuals, including everything from pharmacy, dental, lab, behavioral health, case management, psychiatric services. It's a pretty wide spectrum, and we have multidisciplinary teams that serve individuals that include like employment workers and nurses, really making sure that we can have people live healthy and fulfilling lives in the community. As far as the services that are open community-wide beyond just individuals enrolled in Healthwest services, we are moving much more in a direction of offering more prevention and education services. So we offer a lot of training in mental health. We do suicide prevention training, understanding mental health. We have a new training on social media and mental health and suicide prevention. We offer burnout and compassion fatigue training for companies and individuals. And that's all available on request. We have a kind of rotating calendar of trainings that we offer. And then we also do a lot of one-on-one work with organizations. We're currently in the process of building some trainings for West Michigan Works that we're going to be offering over the next 2 weeks. And we've done stuff for Hackley Public Library and the Lakeshore Museum Center. We really are willing to work with organizations to kind of meet the needs of their employees in that area. A couple other services that are available community-wide include what's called psychological first aid. And we have a team at Healthwest, and it actually spans a little bit beyond Healthwest, but it's kind of led by a Healthwest staff person. And that team responds to traumatic events in the community, and they're trained to do that. And you don't need to be enrolled in Healthwest services. It's open community-wide. And so if there's a natural disaster, a death, really anything that a person or a family deems was a traumatic experience, we have a team that can come and do crisis debriefing and really talk about that experience and really meet people's behavioral health needs in that moment. And we know that by doing that, we can really work to prevent behavioral health challenges that might come down the road if some of that stuff is untreated. We're also doing a lot of virtual groups that are open community-wide. We have some that are available just for the people we serve, but then we also have substance use groups, and we have just like a daily talk time for individuals who might be dealing with social isolation, as well as like a working parents group. We do some early education groups in partnership with Read Early, Read Often, and those are all found on the Healthwest website at healthwest.net, and they are accessible community-wide to anyone who's looking for that level of support. Oh, and I almost forgot about one really crucial service that's brand new too, which is our mental health warm line. It used to be referred to as a crisis line. The number is 722-HELP. And that line used to be used for anyone experiencing a behavioral health crisis in the community. And we've really converted it to be a mental health warm line for anybody looking for support, resources, access to services, whether or not those services are going to be through Healthwest or a community partner. We really want to be available for the community at large to meet their mental health needs. And that line is answered 24/7, 365 throughout the year.
Great, thank you. So you've just explained the wide array of services. It's a huge organization and understandable. You have a wide reach. We also understand that you have a longstanding relationship working with local law offices. Can you tell us about some partnerships you have in that area?
Yeah, Lauren, do you want to talk a little bit about the Handle with Care initiative?
Sure. One initiative where we're partnering with law enforcement as well as the schools and the intermediate school district is called Handle with Care. And this is a model that has been implemented in other communities, and we're working to replicate, where if there is a situation where law enforcement responds to a home and there are children in the home who are affected by a traumatic experience, then they can fill out a form that gets sent to the school with the children's names that just simply says Handle with Care. It does not indicate what occurred or what happened, but it's just a way to give the schools a heads up that something did happen and to handle that student with a little extra care that day, to check on them, to support them. So it's this trauma-informed approach that communities are finding to be really helpful in partnering schools, mental health, and law enforcement in a supportive way.
It's a great idea.
Hey, in the work that we Oh, I was going to touch a little bit more on some of our work with law officers too. We've done a lot of de-escalation training for law enforcement and mental health training in general. We offer jail diversion services at Healthwest too, and we work very closely with our local court system and the jail and the law offices in general. And something new that we've been beta testing during COVID that's working pretty well is that we've actually equipped a couple police departments with iPads where they can reach Healthwest clinicians directly when they're out on a call. And so they'll actually kind of dispatch us through an iPad into the home to do some de-escalation with the family, or maybe connect them to services, or refer out to a community partner for services. And we just started doing that with the office, the Norton Shores Police Office, and it's been going really well. And we're looking to expand that. And we just got an iPad over to Muskegon Township, and we'll hopefully do that with some others as well.
Fantastic. Thank you. Lauren, I think this is an area that you are focused on, which is the My Alliance system of care. Can you tell us how it is working to improve outcomes for youth and families in Muskegon County?
Yes, I would love to do that. So we've had a long-standing history of collaboration in Muskegon County by our child serving systems, such as Healthwest or Community Mental Health, the Child Welfare System, which is DHHS, the Family Court System, the Muskegon Area Intermediate School District, and multiple youth and family serving nonprofits and agencies. And about 5 years ago, there was a group that met regularly called Enhanced Partners that had directors from those various organizations, and decided to write for a federal system of care grant that would bring in $4 million over 4 years to help us collaborate even more effectively and to bring some needed services to our community. And so we did write that grant, we received it, and got to work with. One of the identified areas was school-based services, having more mental health support in the schools. So that's something we focused on with the grant. Also, the idea of a countywide mobile response unit, where if families or youth are in crisis, they can call one number and receive a mobile response to their home or location of choice to help them create a safety plan, get connected with services right then and there. There's also a huge component of youth and family leadership and engagement in really involving the people who are receiving services through our systems and agencies as partners in helping us to better design the system and better design the services. And so those have been some areas of focus over the last 4 years. We did go through a branding process where we put it out to the community to help name our system of care. And so My Alliance was born. And it's a huge collaboration. We have a governance board, and so it's not just a Healthwest program or initiative, it's truly a cross-system initiative where we have participation from the child serving systems I mentioned. We have faith-based, we have youth, parents, young adults, and family members who are actually part of the governance board, helping to set the direction for the future of what we want to see happen in terms of support for youth and families who have mental health needs in Muskegon.
And do you have partners from all of the schools in the county at this point?
From all of the schools?
Yeah.
Well, we went from, I believe when the grant started 4 years ago, there are about 3 or 4 mental health clinicians in schools through Hackley Community Care Center. And now we have around 26, I think was the last count, between Hackley and Healthwest in most of the school districts. So we've continued to expand that.
Wonderful. We understand Healthwest has done a lot of work in the area of diversity and inclusion, and this is an area that Rotary has been focusing on for a number of years as well. Tell us something about what you're doing to build a more trauma-informed and culturally competent community.
Sure. At Healthwest, we have what's called the TIDE team, and that stands for the Team for Inclusion, Diversity, and Equity. Since kind of, stuff has erupted over the last few months here, we have actually decided that although that committee had a really strong role and was doing some really great work, we really needed to put a more dedicated effort to it to move that needle forward a little more. And so just within the past couple weeks, we've promoted an internal staff person to be an advisor to our executive director and to the executive team in the role of DEI, to really help ensure that we're carrying out the goals and objectives that are identified by that team. And so we're really excited to be able to put a little bit more dedicated effort into that. And then I know, Lauren, you could speak a little bit probably to our support and engagement with the community, oh gosh, now I'm forgetting the name. What used to be Speaking Down Barriers group. Community Gathering Initiative.
Sure. So there were a few folks from Muskegon County who went to a conference a few years back, and we saw a group called Speaking Down Barriers in Spartanburg. And they do regular events in their community using spoken word poetry to help facilitate dialogue around race and racism. And so that's something that, we came back very energized and wanting to make that happen here. And so over the past few years, there's been a lot of different partners and community members and leaders involved in making that happen. And so we were able to actually bring Speaking Down Barriers to Muskegon County to train some local facilitators. And we've been holding community gathering events for a couple of years now, every other month. And so that's something that it's not a Healthwest initiative. It's just something that we're privileged to be part of and to help support. And we're excited because we found out we actually received another system of care grant through the My Alliance initiative for the next 4 years, which will bring another $3.5 million into the community. And one of our goals is really around helping better connect and better support with those diversity, equity, and inclusion efforts within the community.
Wonderful. Thank you. This has been very informative. There's some aspects of the work of Healthwest that I wasn't familiar with, so I appreciate learning more about what you do, and would turn the meeting back over to Mark Myers, thanking Lauren Meldrum and Cece Riley for your informative program today. Thank you.